After the age of 60, every checkup begins to carry more weight. We want to know the truth about our bodies. We want to stay strong, and we want to live with peace of mind. A blood test may look like a simple routine, just a needle and a few vials. But the truth is that those drops of blood carry stories about your heart, your liver, your sugar, your hormones, even the strength of your kidneys. Yet here is what many seniors do not realize. A blood test is only as honest as the way you prepare for it. A small glass of wine, a missed glass of water, a restless night, these little details can change the numbers and confuse the doctor. I have seen it many times. People told they have diabetes when they do not, or worried about their liver when the only issue was something they ate the night before. That is why I want to walk with you step by step, not with medical jargon, not with fear, but with clear and gentle guidance. If you stay with me, you will learn how to prepare in a way that keeps your results true, keeps your body safe, and keeps your mind calm. This is your health, and you deserve to face it with clarity. When we are younger, the body forgives small mistakes. But after 60, every detail begins to matter more. A blood test is not just about numbers, it is about direction. The doctor uses those numbers to decide whether you need medicine, whether your heart is under strain, or whether your sugar is rising in a way that could become dangerous. If the numbers are false, the path that follows may be wrong too. I remember a man who came in with results showing very high triglycerides. He was worried, his wife was worried, and we were ready to discuss treatment. But when I asked about his preparation, he admitted he had eaten a large breakfast before the test. We repeated it under proper conditions and his numbers were nearly normal. That small mistake almost led to a lifetime of medication. Preparation is not about perfection, it is about honesty. When you prepare well, your blood tells the truth, and that truth allows your doctor to help you, not chase shadows. Think of preparation as setting the stage. Without it, the picture is blurred. With it, the picture is clear. And together, we can make the best decisions for your health. Food and drink are the first keys to a truthful blood test. Many people hear the word fasting and either forget it or overdo it. The truth is somewhere in the middle. For tests like blood sugar, cholesterol, or triglycerides, you need to fast for 8 to 12 hours, not less and not more. If you eat a piece of bread or drink coffee with milk before the test, your sugar may look higher than it really islands. If you fast too long, 14 or 16 hours, your body goes into stress mode and releases hormones that also change the results. Balance is everything. Water is often forgotten, yet it is as important as fasting. Seniors are more likely to be slightly dehydrated even without feeling thirsty. When the body is dry, blood becomes thicker, veins are harder to find, and results may show false elevations. A simple glass or two of plain water about an hour before the test can make the whole process smoother. Not juice, not coffee, just water. So when you prepare for a blood test, think of it like preparing for a conversation with your body. Do not give it mixed signals, do not silence it with extreme fasting. Instead, give it the right conditions to speak clearly. Medicines are meant to heal, but when it comes to blood tests, they can sometimes confuse. Many seniors take daily pills for the heart, for blood pressure, for diabetes, or for pain. Others take vitamins or herbal supplements. To the body, it all counts. Even something simple like a hair and nail vitamin can change thyroid results. A painkiller can change kidney reading. A steroid cream can raise sugar levels. The mistake is not the medicine itself, but forgetting to tell the doctor or the lab about it. I once had a patient whose thyroid looked abnormal, and we prepared to adjust her treatment. Later we found out she had been taking biotin, a common vitamin, and that was the real cause of the false result. The stress could have been avoided with one honest list. That is why I always tell seniors, write it down. Every pill, every capsule, every tea or oil you consume. Bring that list with you to the test. In some cases, the doctor may ask you to pause a supplement for a day or two. In other cases, it is fine to continue as long as they know. The body cannot hide what you give it, and the test cannot separate what you forgot to mention. Transparency protects you. The day before a blood test is not the time to push your body. Gentle movement is healthy, but strenuous exercise can confuse the result. When you lift heavy weights or go on a long hike, tiny muscle fibers break and release enzymes into the blood. Those enzymes may look like signs of heart strain or liver trouble when in truth it is only the body recovering from exercise. That is why I tell my older patients, walk, stretch, practice yoga, but leave the intense workouts for after the test. Alcohol is another factor that many forget. Even 1 or 2 glasses of wine can raise triglycerides and liver enzymes for the next day. If you are being tested for those functions, a single drink can make the numbers look worse than they are. Better to avoid alcohol at least 24 hours before, and if you can, 48 hours. It is a small sacrifice for a clearer result. Caffeine and tobacco also matter. A strong cup of coffee can elevate blood pressure and heart rate temporarily. Smoking just before a test can increase certain stress hormones. Neither tells the real story of your health. Finally, think of sleep as medicine. A good night's rest calms the body, balances hormones, and allows your blood to show its true state. Preparing your lifestyle the day before is not about restriction, it is about honesty. You want your blood to tell the truth, not yesterday's habit. The mind and the body are never separate, and your emotional state walks into the test with you. Stress can raise cortisol, quicken the heartbeat, and even raise blood sugar for a short time. I once had a patient who rushed into the clinic late, breathless and anxious. Her results suggested trouble, yet when we repeated the test in calm conditions, everything was normal. It was not her body that was sick, it was her mind that was unsettled. That is why I encourage seniors to treat the blood test as a calm appointment, not a race. Arrive early, sit quietly for 10 or 15 minutes. Breathe deeply, let the shoulders drop, let the hands rest. Do not scroll through alarming news on your phone while waiting. Give your mind a chance to slow down. Think of the test as a conversation between your blood and your doctor. You want that conversation to be clear, steady, and truthful. If you enter in panic, your blood will whisper the language of stress. If you enter in calm, your blood will speak in its natural tone. Preparation of the mind is just as important as preparation of the body. A few minutes of quiet, a simple breath, and a gentle reminder to yourself that this test is here to guide you, not to harm you, can make all the difference. Clothing may seem like a small detail, but it can shape the entire experience. I have seen seniors struggle with tight sleeves, layered sweaters, or stiff cuffs that made it hard to expose the arm. Each extra minute of rolling and adjusting increases tension and sometimes makes the process more painful. The best choice is a loose short sleeve shirt or a cardigan that opens in the front, something that allows the nurse easy access to both arms without struggle. What you bring matters too. A small bottle of water can prevent dizziness after the test. A simple list of every medicine and supplement can save confusion later. A small notebook can be useful to write down instructions or questions you want to remember. Think of it as preparing for an important meeting, a meeting with your own health. When your clothes and belongings support the process, you remove obstacles and reduce stress. Simplicity in what you wear and what you carry is not just comfort, it is wisdom. It allows you to focus on what truly matters, the accuracy of the test and the care of your body. After 60, the body does not behave the same way it did at 30 or 40. Age itself changes how blood tests should be read. For men, testosterone levels naturally decline, which can affect energy, muscle mass, and even cholesterol reading. For women, menopause or hormone therapy changes lipid levels, bone markers, and thyroid function. If these factors are not shared with the doctor, results can be misunderstood. Hormones are only part of the story. The aging process also slows kidney function, alters liver metabolism, and shifts the balance of electrolytes. A result that looks unusual for a younger person may be completely expected in someone older. This is why context matters more than numbers alone. I once had a senior patient whose blood sugar was slightly above the normal range. He feared diabetes. Yet when we considered his age, diet, and overall health, it was clear that his numbers reflected mild age-related changes, not disease. That distinction is critical. The lesson is simple. Always tell your doctor about hormonal treatments, changes in appetite, or new symptoms. Do not assume the lab already knows. Your blood does not exist in isolation. It exists in the context of your years, your history, and your choices. Age is not an obstacle to truth. It is the lens through which truth must be seen. The moment of the blood draw is often where anxiety peaks, yet with a few small steps, it can become calm and simple. First, communicate clearly. Confirm with the nurse which tests are being done and whether there are any special instructions. This prevents mistakes and reassures you that nothing is forgotten. When the needle goes in, focus on breathing. Inhale slowly, exhale gently, and let your shoulders stay relaxed. Some people find it helpful to look away or to chat lightly with the nurse. Distraction reduces tension, and tension is what makes the experience harder. After the blood is drawn, do not rush. Many seniors stand too quickly and feel dizzy or faint. Instead, sit for a few minutes, sip some water, and allow your body to settle. This is not weakness, it is wisdom. Even strong people benefit from a pause. Before leaving, check that you know how results will be delivered. Will the doctor call, or do you need to schedule a follow-up? Is there an online portal you can access? Confirming this now prevents confusion later. The blood draw is not just a task, it is part of a process. By treating it with care, you turn a simple appointment into a safe and meaningful step toward clarity. The paper you receive after a blood test can feel intimidating. Numbers, ranges, and words that seem technical can stir fear. But remember, a single result is never the whole story. A slightly high or low number does not always mean disease. It may reflect a meal, a medicine, or even the time of day. That is why interpretation must always be shared with a doctor. The real value of blood tests is not in one result, but in patterns. Over time, your results create a map of your health. This map can reveal whether blood sugar is slowly rising, whether cholesterol is improving with diet, or whether kidney function is stable. A wise doctor looks at the whole map, not just one point. Turning results into action means asking questions. What does this mean for me? Is this change temporary or permanent? Do I need medicine, or will lifestyle changes help? These questions create partnership, not passivity. I once told a patient that his cholesterol was high. Instead of panicking, we reviewed his habits. He adjusted his meals, walked daily, and 3 months later, the numbers improved without medicine. That was action based on truth, not fear. The blood test is a tool. It should guide you, not frighten you. When you see it as a conversation rather than a verdict, you gain power over your health. Many seniors see blood tests as something to fear, a reminder of aging or illness. But what if you could see them differently, not as threats but as allies? A blood test does not create a problem. It only reveals what is already there. And by revealing, it gives you the power to respond with clarity instead of guessing in the dark. Making peace with blood tests begins with routine. When they become a normal part of life, like brushing your teeth or walking each day, the fear fades. The more consistent you are, the clearer your health map becomes and the fewer surprises you encounter. It also helps to reframe the purpose. Each test is a chance to measure progress. Are your new habits lowering your sugar? Is your new medicine balancing your blood pressure? Is your diet supporting your kidneys? The test shows you the answer. Seen this way, it is not a punishment but feedback, a form of encouragement. Finally, remember that you are not alone. Every senior who steps into a clinic feels some of the same nerve. By asking questions, preparing well, and showing patience, you become a partner in your own care. That partnership brings confidence, and confidence turns the unknown into something manageable. A healthier relationship with blood tests means moving from fear to respect, from worry to wisdom. Each time your blood is drawn, you are choosing knowledge over ignorance, strength over uncertainty, and that is a powerful choice. In the end, preparation for a blood test is about more than fasting or drinking water. It is about approaching your health with honesty, patience, and care. Every step, from the clothes you wear to the calmness of your breath, allows the test to show the truth of your body. And truth is what guides good medicine. After 60, health is not about perfection. It is about awareness. A blood test is one of the simplest ways to stay aware, to adjust when needed, and to continue living with strength and peace of mind. So the next time you are asked to give blood, do not see it as a burden. See it as a conversation with your body, a way to listen, a way to learn, and a way to keep moving forward with clarity. Your health deserves nothing less.